Every mother deserves a safe birth. Every woman deserves to live with dignity. Obstetric fistula is a devastating childbirth injury caused by prolonged, obstructed labor without proper medical care, which affects thousands of women in Uganda every year. Many survivors endure pain, incontinence, social isolation, and deep emotional trauma due to lack of awareness and limited access to treatment. In a bid to put an end to maternal mortality and fistula, CLIPASA and SAMAHE bring hope to fistula victims in groundbreaking Kitovu Hospital outreach.
Hello friends, this is Robina Namulindwa, CLIPASA President France and Switzerland. I'm having a trip in Uganda which works on ending maternal mortality. That's in Uganda, Africa and beyond. Introducing to you SAMAHE members and CLIPASA members from Uganda. Hello CLIPASA members and SAMAHE. I would like to say thank you for being with us since we started this journey of ending maternal mortality in Africa and beyond. I had a privilege to meeting these women from all over Uganda who have gone through fistula and the journeys they have gone through to see that we end maternal mortality together. We had a warm welcome in Kitovu Hospital, that is in Uganda, and I met a sister, doctor, who is the overall in charge to these fistula patients.
Thank you very much. My name's Sister Dr. Nabukalu, Coordinator of Fistula Program in Kitovu Hospital. I am glad. I am happy. We are going to see the staff, but as well, you are going to see the patients who have come for review, those who have been cured, repaired, and have been cured. Then you are going to see the real patients now who are being operated on the ward. And we are going to see also other women waiting for operation. So thank you so much. I'm so happy that you have come, and we are so grateful for the support we get from different peoples and friends to enable us to help these vulnerable mothers who come here. They come very depressed. By the time they go home, they are smiling. And we are going to see the women now who have just come. They are smiling. Some have even gotten their babies.
We had a talk on how we can help these women, how we can help them maneuver through the journey, and then bringing them hope. I sensitized them on ways of preventive measures on how we can control what can lead to this. That I don't want to mention every time, but fistula. These women are able to comply and be able to be a voice to other women. So looking at them and looking at ways that they can go through this and stop it is one of the ways that I saw that they are willing to go through the process but help someone. That is being a voice. I sensitized them. I told them of the dangers and the advantages of being a voice. And they are willing to help me spread the information to other women. I had two women talking about their journey on how they got it.
Erinnya lyange nze Mariam, nga njagala mbabula ekisitole yange katini wadde yali nnene naye ngenda gitemaatema. Nagenda nezaala omwana wange owokusatu, nefuna obuzibu nti omwana wange yafa nga mmaze omumuzaala naye nensigala nga nina pain mu lubuto. Bwe nasigala n'obulumi obwo, wayita weeks 2 nenkola scan ne baŋŋamba nti nina ekizimba mu lubuto. Kati bamaliriza okunzijjako plaster ku lubuto, omusulo nga gumpita mu lubuto. Nembeera n'ekyo ekizibu okumala weeks nga 3, era nanzizaayo. Era still embeera nesigala nga yeemu. Kati mu kwebuuzaako ku bantu ne batulagirira tujje Kitovu Hospital, era ne tujja ne tulaba abakyala abasawo bakola ku fistula, era ne banzijanjaba bannongoosa bulungi era nawona.
Mine it happened in hospital. It's happened in hospital. I went to the hospital but I don't know this delay because they told me that there are many emergencies in the theater, so they took me when it was late, and eventually the baby died. Then I experienced all that. That's 4 months, it was a tug of war. 4 months during fistula. Many people come here when they don't know that they will be fine because they have been at home, moving from one place to another, so they become when they have that denial. But you have to encourage them, emphasize them that you'll be fine.
So as we always say, let's end maternal mortality by looking at stories, encouraging women, and becoming a voice on how we can end maternal mortality and morbidity, and looking at ways of becoming a voice to these women. Let's end the maternal mortality. Thank you. At the end of the day, we had to look at the saviors. These are mothers that got fistula but were worked on. They got operated, and when they're okay now, they can go back home, be with their husbands. Of course, most of them were neglected by family members, their husbands, and people near them. So these saviors, some came to this meeting. So we look at more fistula patients on the ward. They have fresh wounds, so they are encouraged to stay on the ward. Then we have these mothers behind me who came for just to follow up, to see are they fine, how are they maneuvering through this journey of the healing phase. The World Health Organization talks about the 4 antenatal visits that these women get during the 9 months of pregnancy. But then we tend to give them more visits depending on the situation. Let me say she comes in and she has malaria in pregnancy, a big baby, a previous scar, or she has a breech presentation, anything that can complicate the 9 months or the baby, so that at the end of the 9 months, the mother and the baby are not okay. Anything like that, we deal with it. So they tend to be followed more than the 4 visits that are recommended by the World Health Organization. So we tell them to come for more visits. If we see that these women are not able to come to the clinics, a midwife can visit them home. Through doing so, we are trying to prevent what or anything that can lead to fistula. So we had to share with them a meal. This was something interesting to see how happy they were. They sang to us. They gave us hope, by the way. I thought I was bringing hope to them, but they became hope to us. And that's encouraging, looking at ways on how we can combat this. Coming as a village together and then looking at ways of helping these women become one as a voice. So we gave them gifts. Gifts are always bought by funders and people who are wishing us or wishing these women the best after going through the fistula, because some of them are neglected by village members and then families and their husbands. They leave them and then they stay by themselves. Some of them have kids. They are still going through fistula. So we look at ways of helping them. How do we help them with the soap? To wash clothes. Remember, if they have fistula, they always walk with a bag which contains urine and stool. It's inconveniencing to other people. So sometimes we keep them at a hospital. Kitovu Hospital has a ward where these women stay and then be able to find a home. At the end of the day, if they're able to go to their homes, yes, we say you can go home. So these women behind and in the ward in front of me are some of the groups that we've looked at. Fistula can be avoided if antenatal clinics are done. I taught mothers about the advantages and disadvantages of not having proper antenatal assessment. I'm with that voice that wants to help others become also voices. Yes, as I always say, let's end maternal mortality. Thank you.
How you can help. Donate to fund fistula surgeries and maternal health programs. Volunteer your skills in healthcare, counseling, or advocacy. Spread awareness by sharing this story and breaking the silence on fistula. Join us today. Visit www.clipasa.org.